Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Alif Daniel bin Jamil Hasmadi. I'm from SR1134B. Today, my group and I will present about musculoskeletal injury under the topic of strain and sprain. In this slide, it contains a 7 topic, which is meaning strain and sprain, sign and system, stage level for strain and sprain, definition for each stage, causes of strain and sprain, prevention of strain and sprain, and lastly is treatment. The meaning of musculoskeletal injury refers to damage of muscular or skeletal system, which is usually due to a strenuous activity. Next, I will explain about strain. What is strain? Strain is an injury in which muscles are strained or torn. A strain occurs when the tendons bend at the end of muscle that connect muscle to the bones, get stretched or pulled away from the bone. This can also happen as a result of a fall or twist, but are more likely to happen over time as a result of overusing the muscle. Next, I will explain about sign and symptom for strain. For someone that occur the strained muscle, it will feel the pain at the part of the muscle. Second one is swelling. Third one is bruising. We can see the bruise from the part of the strain. And the fourth one is movement restriction, which make someone that have strained muscle will hard to move, and it will make the muscle weakness.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Dinin Saifuddin bin Muhammad Dinain from class SR1134B. For this slide, I will explain about the definition for each degree of pain for strain. The first one is the first degree of strain. It means that there is little tearing or stretching of the muscle tissue, but a full range of mobility is still possible. The muscle may feel stiff, but the muscle still can bear some weight. For example, if they want to do light exercise, it is still possible. The injured muscle will show some mild swelling and give a mild pain to the muscle. Second is the second degree strain. Second degree strain is the same as the first degree strain, but there is more damage to the muscle or to the tendon, and it is weaker than it was before the injury. There is usually quite a bit of swelling and bruising as well, which cause the range of motion decrease, and the person will feel a moderate pain. For example, you may have pain even when you are lying down or sitting still, and it is usually quite painful when you try to use the muscle. The last one is the third degree strain. A third degree strain is considered a complete tear accompanied by bleeding, severe swelling, severe pain, followed by little or no pain at all. Besides that, there will loss all of the function of the associated muscle. It is because the muscle cannot fully function. To put it simple, the person will experience a total loss of movements. An example of a third degree strain would be a rupture of the biceps tendon.
Hi and Assalamualaikum to my lecturer. My name is Nur Ashikin binti Harun from class SR1134B. I will continue about the presentation, which is sprain and strain. So today I will explain the cause of muscle strain. Cause of muscle strain divide 4 category, which is for the first, not warming up properly before do physical activity. It is because inability to prime the pathway between your nerve and muscle to be fully ready for a good workout. Furthermore, it will unable to increase enough blood flow into the muscle group, which is vital for delivery oxygen and essential nutrient. Okay. For the second is poor flexibility. Poor flexibility means more difficultly when performing your daily activity and can cause joint stiffness, muscle tightness, lower pain, and health related problem. So for the third is for poor conditioning. Poor conditioning can create some common symptoms such as being injury easily during strenuous activity. For example, do jumping rope, jogging, and race walking. And for the last but not least is overextension and fatigue. Typically causes by overextension causes by repetitive movement. It may also be related to incorrect technique or walking in extreme temperature. For example, if you are overextension, you may develop fatigue, pain, or become more prone to injury. I will continue for the next slide, which is prevention of muscle strain. Okay, firstly is maintain good posture when you standing or sitting. For example, if you spend a long time in one position, try to alternate putting one foot or one foot and then the other footstep. This can help decrease stress on your back muscle. Secondly is try not to sit in one position for too long, which is take a frequent break to move and change position. For example, you can use a chair that provide good support for your lower back or use a pillow for support. Okay, for the third prevention is lift object carefully. You should keep your back straight, bend at the knee, and always lift your leg. Furthermore, you should hold the weight close to your body and don't lift and twist at the same time. Next, we go to take precaution to prevent falls. For example, you should holding handrail on stairway, avoid slippery surface, and keeping your floor uncluttered. Okay, and lastly is do regular stretching and strengthening exercise. It can help to minimize your risk of muscle strain. Okay, that's all from me. I will pass for the next presenter.
For this slide, I will explain about the treatment for strain, which is the treatment that stand from the RICE. The first one is R, which means is rest. Someone who have the strain we need to avoid activities that can cause pain, swelling, or discomfort. But they do not avoid all the physical activity because some of the physiological need to do a physical activity which can help the muscle to recover. Second one is I, which stands for ice. It need to use an ice pack or bath of ice for 15 to 20 minutes each time and repeat every 2 or 3 hours. This can help to reduce the bruising at the part of the strain. Third one is C, which stands for compression. It means that do not wrap it too tightly. It will hinder the blood circulation. We need to lose the wrap if the pain are increased. The area becomes numb and swelling is occurring below the wrap area. The last one is E for elevation. So we need to elevate the injured area above the level of your heart, which allow to gravity to help reduce the swelling. So next I will pass to my friend.
Bismillahirrahmanirrahim. Assalamualaikum. My name is Nurin Akilah binti Mazlan and I am from SR 1134B. So today I will continue our presentation about sprain and strain. So today I will explain about the sprain. What is sprain? Sprain is an injury in which ligaments are stretched or torn. A sprain is a stretching or tearing of ligaments, the tough bands of fibrous tissue that connect two bones together in your joint. The most common location for sprain is in your ankle. Okay, we move to the next slide. It is about the signs and symptoms of the sprain. The sign and symptom for sprain and strain are similar and may include pain and swelling in the injured area, difficulty using or moving the injured area in a normal way, feel warm, bruising, or redness in the injured area. This can cause loss of the ability to move and use the joint, and it is called functional ability.
Next slide, I will explain about the definition and stage degree of pain for sprain. The first degree for sprain is the most common sprain, and it is a minor injury if not neglected. A first degree sprain is a slight stretching of one or more ligaments, and it will cause some mild pain at the muscle. There may be mild swelling, but the instability will be minimal as they can. If we take an athlete as an example, the athlete can expect to resume their training in 1 to 2 weeks with conservative therapy and enough rest. The second one is the second degree of sprain, and it means that half of the ligament has tear. This is the most common type of ankle sprain, and it is characterized by moderate pain in addition to moderate swelling, bruising, and some difficulty with movement. They have difficulty in movement because the instability increases due to the partial tearing of ligaments. The approximate recovery times for this injury is usually take to 3 to 6 weeks. Last but not least is the third degree sprain. As with burns, there are also third degree sprain. The definition for third degree sprain is that there is extensive tearing of the muscle, which severely limits the use of the muscle or makes the muscle completely immobile. This is because the instability will increase greatly.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ainur Shanifa binti Joharif. So I will talk about the causes of sprain. So what are the causes of sprain? There is many causes of the sprain, but here I will explain to you the three of it. So the first thing is sprain can be caused by if you are not warm up properly before you do physical activity. When you not warm up before you do the physical activity, your body, your muscle are not ready to work properly, and your muscle will shock with the movement that you do, and it will lead to the sprain. So the second one, sprain occurs from walking. When you are jump, you are running, you are walking. So basically, sprain will happen to you if you do the physical activities. like walking, running on uneven surface. Uneven surface is so sprain will be happen to you when you do physical activity like walking, running on uneven surface. Example of uneven surface is mountain and grass. So when you jump and landing awkwardly, your ankles can be twist and it will lead to the sprain happen to you. So now the third one is sprain can be happen when you falling and landing on your wrist and hand. So when you do a racket sport such as tennis and your arms are over extension stretch, it can be lead to the sprain. Okay, for the next slide, we move to the prevention of sprain. So the first thing you should do to avoid your body from a sprain, you have to warm up properly before you do physical activity. It is important to warming up the muscle because it will increase their range and avoid the tears and can avoid trauma to connective tissue. And the second one, do physical activity at a safe place. Do not do any physical activity when you are at unsafe place, such as you do jogging at mountain, you do jogging at uneven surface like grass. So it is not suitable place for you to do any physical activity. When you want to do any physical activity, please at park, at gym, or any kind of safe place that you sure you are not risk to get injury during when you do the physical activity. So the third one, what things you should do to prevent the sprain, you should use the suitable equipment for activity. So when you are jogging or do any physical activity, you should use the suitable shoes that fit your foot very well and makes you feel comfortable to do any physical activities. For example, when you not wearing the suitable shoes when you do any physical activities, you are risk to landing awkwardly, especially when you do jumping exercise. It can cause sprain and also makes your ankle more vulnerable to get injuries. Thank you.
Alright, now we move to the next slide. It is treatment. What is the treatment for sprain? It is RICE. R-I-C-E. R is belong to rest. What is rest? If the injured part is not rest and is subjected to external stresses, the healing process never take place. And then I is belong to ice. What is ice? Ice is pain is reduced as cold slow the speed of nerve transmission. With ice treatment, the athlete usually complains an uncomfortable sensation of cold, followed by burning, then an itching sensation, and finally completely numbness. For the next one is C. C is belong to compression. Compression should be applied both during and after ice application. And the next one is elevation. Elevation is the injured part, particularly an extremity, should be elevated to eliminate the effects of gravity on blood pooling in the extremities. Okay, that's all from our group. So thank you and Assalamualaikum.